So we are going to have just, so we are just going to have 2 sessions. So the first section will be MCQs and then true or false. So the true or false will just be 10 questions, and then the multiple choice questions will be 30. So in all, we are doing 40 section A questions. And then we are going to have section B. So for the section B, we are basically going to answer all questions. So we are going to have 3 clinical scenarios. So the first would be a question under ear, any question on ear and its related pathologies. And the second one will be under nose, and the last throat. So this is how I would want you to answer the questions. Like I said, for the MCQs, all the things that we discussed, all of them are coming. And then the true or false, there wouldn't be any plus or minus 1. I mean, I'm basically not going to, deduct any mark for a wrong answer. So for the section B, the first question under nose, under ear, a scenario can be put like, okay, so a 3-year-old boy presented with probably a fever of temperature 38.3 degrees Celsius. And he also complained of pains in the ear. So that could just be the simple scenario. And then you would have sub questions to answer. So the first question can be, what are the likely symptoms this child may present? Or what are the symptoms this child is likely to come along with? And then the other question can also be, how would you investigate to come to a definite diagnosis? And then the last question, the C question can also be, state 2 or 3 differential diagnoses and state one definite diagnosis with reasons. And then the D question can also be, how are you going to manage or treat this patient? And then you can have an E question, which can also be, what are some of the likely complications associated with this pathology or this condition? Yeah, so this is how the question will be structured. And once again, it is just, you just go straight to the point. Ideally, I could have just said, or I could have framed the question in such a way that, you go through all the motions yourself. But you guys, you are undergrad, so I don't want to burden you that much. So, for example, like if a child presents with ear pain as well as fever of 38.3 degrees Celsius, and then you have like state 5 other clinical symptoms that this patient is likely to present with. You know that there could be a possible headaches. There could also be a possible ear discharge. You know that there could also be some form of hearing disturbance, whether it is a sensory or whether it is an obstructive hearing loss. There could also be some form of that. And then you also know that, remember that if you are seeing clinical features, it includes both the symptoms and the signs. Remember, I didn't say symptoms. I said which other clinical features are the patient likely to present with. So in that situation, you would have a host of stuff to write. If we are talking about pathologies or symptoms that can affect the ear, the symptoms side, we can write about 6 or 7. And the signs, that is, if you do your otoscopy, you are expected to also describe the nature of the tympanic membrane. So you have a lot of things to write or to state. So assuming that this ear pain with fever, that it's likely it could be an otitis externa, or it could also be any of the 3 forms of acute otitis media. It could be any of those 3 types, either the acute, either the suppurative, or even either the chronic otitis media, depending on the extent or the duration. Like I said, you can just state your 3 differential diagnoses. You'll be asked to state the possible definite diagnosis, and then you can equally state reasons why you are opting for this definite diagnosis. And then with respect to investigations, maybe you can also state that, so we will do a full blood count. If there is any ear discharge, you could possibly do a swab for culture and sensitivity. And then for the treatment, I'll be glad if you are able to state the reasons why you are giving certain medications. So if the child is having fever with otalgia or with pains in the ear, you're expected to relieve the symptoms. So you could give some analgesics to relieve the patient of the discomfort, as well as to crush the high-grade temperature or fever. And then after a full blood count, after knowledge on the full blood count and the possible swab for culture and sensitivity, you'll be able to prescribe the appropriate antibiotics. If there will be a need for you to do some oral toileting or oral wash, you'd also state appropriately. So this is how simple the questions would be like. So it is just going to be, that's like in bits, just that, and then you just go straight to the point, and then you sort me out. The same thing applies to the nose as well as the throat. So that is all. I mean, basically. Yes, so that is it.
Hey,
do you have any question for me?
Yeah,
hello,
we
sir.
now receive the notes on under the notes.
Pardon?
Epistasis. You said you give us notes under the notes, but we have not received it.
Notes under what?
Nose. The slice under nose.
Nose.
Oh, are you sure? I thought I sent everything to you.
Yeah. No, sir, we have not received it.
Ah. Oh, how possible? No. I forwarded. Please, which class is speaking?
So this is weekend.
400 weekend.
Nick.
Hello, Doc.
Have I not sent you the notes on under notes?
Doc, I have only 4, I think, slides from you. There is no nose in it.
Please, what about Thomas? Is Thomas around?
Nick.
Oh, but you should have informed me a long time. I've done that.
Doc, is it the nose that says the throat and the neck?
I'm coming. 1, 2, 3, 4, 5, 6. Oh, I should have not sent this note then. Oh, I'm very sorry. Oh, why you should have alerted me? Let me see. Okay. Yeah, I'm going to do that. Okay, I'll do that for you guys. I'm very sorry. Oh, I think you're okay. I'll do that. I'll definitely do that. After by the end of this session. So sorry. Anyway, yes. Please, do you have any other questions for me?
Hello, sir. Please, what's the time duration? The time for the exam? Is it 1 hour or 3 hours?
3 hours.
Is it 3 hours?
Oh no. This one is just 1 hour 45 minutes paper. It's simple. I mean, it's just a straightforward exams. So 45 minutes for the MCQs, and then you do an hour for the
okay.
Like if you know. I mean, I remember for the past 3 years now. I mean, I remember someone finished within an hour, and the person had 87.
Okay.
Yes, I really remember. I think 2019 before COVID. Yeah, before COVID. Yeah, someone just finished within an hour. Like they are just straightforward. You just make sure that at least you are much abreast with the basics. The basics, and the basics are that okay. Once again, first things first. And like the basic clinical conditions that patients are most likely to present, in the hospital or the clinic or in an emergency setting. Yes, I'm always generous. So I always tell people that epistasis may come. Epistasis may come. So you have to learn everything about epistasis or epistasis, or I don't know how you are going to pronounce it, but it is definitely coming. So you should be able to know how to manage someone with epistasis. I mean, this one is not rocket science. Everyone should know it. You also have to know about acute otitis media. You have to know about some of the congenital conditions of the ear. You have to know some of the infective conditions. It could be furunculosis. It could be the typical bacteria, or some mild viral infections affecting the ear. At least you should have a fair idea about how we can hear, about this whole hearing thing. You should also be able to appreciate some of the various sinuses that we have, and then at least you should be able to manage some simple conditions or pathologies of the nostrils, nasopharyngitis, allergic rhinitis, ranging from a possible, even could there be, is there something even like rhinosinusitis possible? You could have an infection occurring within the nasal cavity at the same time spreading to the sinuses. This is possible. And then even with the throat, when you go there, pharyngitis, talking about, some of the various congenital conditions within the throat, you should be able to just manage them. And for MCQ purposes, at least you can also appreciate some of the various blood anatomy of the ear, the nose, and the throat. Some of the various structures within the throat, some of the blood supply, some of the major nerves that supplies both the outer, the middle, and the inner ears. The communication between the ear, the nose, and then the throat should be able to, at least have a fair idea about how, the ear, nose, and throat are communicate. You see, you should be able to also know some of the various types of the pharynx. Yes, and its communication with the nose. With the nasal cavity. Yes, and then the parasinuses, hearing loss. Some of the examples of both the congenital and then the acquired sensory neural loss, as well as the conductive hearing loss. You should be able to know some of the.
Okay.
Hey, you.
Yes. Yeah, so basically that you should be able to appreciate some of these things. Yes, so I said 20 minutes. So if you don't have any other,
Sir,
yes, please.
Unless you are writing your paper on the 2nd.
Yes, please. Yeah, sorry. Yes. I have an urgent assignment in Kumasi on Sunday. Yeah, it's very, very, very urgent. It's very urgent. I have to.
But sir, I learned on the 2nd is holiday too. The Muslims are celebrating their.
Oh, rather.
Yes, Monday and Tuesday. Yeah,
no. I thought the Muslim holiday is on the 3rd.
Yes, that's on the 3rd. Monday is for 1st May. Evans, there's no Muslim holiday.
Monday is for May Day, and Eid is on the 3rd.
Yeah, so that's the reason why I'm just pleading that if you can just squeeze yourself for me, I beg you. Yeah,
okay, sir.
Then,
right.
Yeah, hopefully nobody feels. I don't want to feel anyone this time around. Last year, yes, I think last year, during COVID, only 4 people had less than 50, and then last year I think the number rose to 6 because they were a lot. So this time around, I hope everyone gets 50 and above, and it's easy to get it. Trust me, it's very, very easy to get it. It's very, very, as long as you came to the class. Basic principles first. You know what the condition is, how the conditions are present itself, both the symptoms and then the signs. You should be able to know how to investigate this typical condition, and then how to also try and then manage it, and then some basic complications if these conditions are not properly managed. As simple as that. And once again, like I said, basic principles first. Okay, you guys should be fine. So see you guys on Monday, God willing. Okay. So I'll quickly send. Yes, please.
Yeah, please. Something. We couldn't have some courses done in level 200, so we added it. We did it this time around. So we had a lot this time around. This. So when you are marking, you just have this is compulsory for us.
That's all. Consider.
So the memory, how to put everything in memory is difficult for us.
The memory has grown.
Okay, you you let's see how it goes.
Okay, thank you.
You are
How
welcome.
you are-
Okay.
Biology is no.
Yo, so Charlie, you guys are all the best. So we'll meet on Monday. Okay.
All right, thank you.
Thank you very much.
Okay, you are welcome. Okay.
Yeah,
Bye.
bye-bye.
Hello, Evans. Evans.
Yes.
In Kadabe
thank
na
you, sir.
person chop paper. No go person chop on Saturday ana.
Hey, about then what your problem? I be some question. Me a question.
Ah.
Who be
Okay,
sending
Ebi
reach
ni
a
kwa ndi
question.
ashe
Who be sending
Monday
question?
anka
Jamal,
Sunday
Jamal.
over becho.
Christmas.
Jamal timetable
Ah.
Jamal timetable now per question is bizarre. Who be
Professor
sending?
Johnny Christmas.
Nipa na favor wo san so pe on trim brain bi manade.
Professor Johnny Christmas.
Oh, Lorena, what's your problem? Ah, I'm be some question. Me, what's
Who
your
be sending
problem?
question? Timetable no. Man can't just say lecture and mind Saturday. Open
Ebi
information.
yeah di we ni bobo ho no. Ebi mo complain say time no we. Afi dey atwi mu a still person ka be ni bio. Hey.
Mommy, Uncle Finney, Uncle Casimir.